Okay, I'm going to have to interrupt your conversations in the service of getting everyone out of here at 11 o'clock. Let me just start by asking if anybody has a actionable item they would like to share with the group. Many table. Yes.
We were just discussing that, how do we operationalize getting, allowing CPD to be given for actually working in interprofessional teams as part of our daily work. Kind of rethinking that. So if we're working in an interprofessional team, we're sharing ideas, we're learning from each other. Maybe we're doing some grand rounds, those kind of things. How do we operationalize that could be CPD? Because, you're learning so much more there than sitting in a room watching PowerPoints.
Excellent. I think we have some people in the room that can help you with answering that question. Okay, and you're going to see her right afterwards, right? Okay. Any other would like to volunteer an actionable item? Yes. Kathleen.
So yes, Kathleen, yeah. So one of the things that you mentioned, I think, at one point in the conversation was the advantage of having networking and talking to people around the room as well as the formal presentations. So I have to acknowledge Malcolm Cox and Deb Troutman for my thoughts, which are, so I'm at the VA in the Office of Academic Affiliation, and in that office we oversee all the clinical educational activities, including nursing education. And what we've observed recently is that the academic and the Office of Nursing Services, OAA, and Office of Nursing Services specific to nursing may have sometimes very different sort of missions and goals. So my thought is to help align those two, the academic and the Office of Nursing Services, a little better, and bring in some external organizations to start to, make sure that we're specifically stating and being more conscious about moving the educational mission forward along with the nursing activities.
Thank you, Kathleen. Excellent. Great. Allison?
So this is my first meeting, and it has been an extraordinary sharing of diverse perspectives and diverse lenses from a great group of innovators. And as a member of the AMC, one of the prime things that we try to do is really disseminate great ideas to our members. So I came away with a list of 3 or 4 very specific workshops that are bringing different ideas together that I hope that we can bring to our national meeting to really continue the conversation, because we have this I have this privilege of networking and hearing from all of you, and the ability to think about how we can disseminate that much more broadly is a wonderful opportunity.
Great, thank you. Anyone else? Yes, Darlene.
Thank you. We have 3 action items. One is to review the consensus report as well as the 9 reports that this group has processed, sort of put them together and take a look of where they cross, and not to forget all the wonderful work that's been done. The second is to going back to the professional organization or setting and taking time out of the MOC process. And the third is to study the MOC of individual professions and look at the impact that has on the others in the interprofessional network.
Great, thank you, Darlene. Anyone else? Yes. I can't see.
Hi, Darla Spence-Coffey from the Council on Social Work Education. So I am actually presenting in 2 weeks to a group of social work regulators on ensuring continuing competence beyond CE. So this was quite timely for me. What I wanted to say is that, I am all for thinking about how we can work together interprofessionally, but there's a lot of work that some of us in the room need to do within our own professions to get at the table in order to be able to do that. And so I'm just going to say, and we're one of them, and so we're working on it.
Great, thank you. I saw a hand over here. Yes, Julia.
Our table talked about some of these same issues, but I think a couple of other things that we talked about were translating data, evidence, and coming to data evidence and outcome into a patient outcome. Also tracking networks, like some of these social learning, looking at networks, and how do we track that network situation over the long haul to see where the change has happened, which would be quite interesting. Also, one at our table talked about going back and having a conversation with key staff and thinking how they might integrate some of these ideas into a 10-year initiative that's already on the table. And then we also talked about how this is all quite disruptive and that this is a serious shift and that there's a lot of struggle.
Thank you. Lots of struggle, lots of conflict, as we were reminded earlier. I can take one or two more. I'm sure there's lots of ideas out there. We're trying to just get it out into the community. Okay, one more, and then we'll wrap up.
Well, I don't speak for the table. I'll speak for myself.
Thank you.
What's in it for me, right? That's the radio station everybody listens to, WIFM. What struck me is something that Darla said about, I think the IPEC really can look at what is right for the team, but also what is right for the individual. And the thing that came to me was connecting the dots, because we had so much great work done on stress, and today Lucy talked about providers feeling that they can't do one more thing. And so I guess it comes back to, we've looked at big systems trying to solve problems, but I'm not sure we've still come back to how we really engage the individual and make it meaningful to the individual. And so what struck me is some work that's being done at Harvard that's just really powerful on both teams and individuals, is psychological safety. Because if people don't feel psychologically safe in what they know in this very rapidly changing environment, and just with all of the technology, and then psychologically safe in teams, that maybe there's some common threads there that we could think about meeting that individual practitioner's needs, both within their profession and across the professions.
Thank you, Patricia. Okay, now what, so what? This is a beginning list. We anticipate many more will come forward as our relationships continue to grow and our work continues to expand. So let me first wrap this up by thanking all members of the Planning Committee who were instrumental on this. And I guess especially Patricia and Megan and Amber, who have supported our learning and in ways beyond. Okay, so here are some final logistics things we want to remind everyone around. First of all, there will be an evaluation emailed out to everyone and ask for your feedback and how we can continue to act on the messages of this workshop and the action items that you've identified. The slides and the videos will be on the workshop website in about 2 weeks, for those of you who want to follow up on those. As I said, there will be a proceedings. It will be issued, expected time is at the next workshop, and the next workshop topic, it will be on digital technology and health professional education on November 16th and 17th, so save the date for that. And finally, we'd like to certainly thank our webcast viewers for hanging in there with us, being part of the much larger global community on the business case for high value CPD. So thank you all for coming. You know, first rule of adult education is start on time. Second rule is end on time, and we have done that. So it's good to be here with everyone. We're concluded.